First ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Since we were talking about what can pass from mother to child, it brings us to the next question, which is from Middle Road, which is Reshma's asking, and it goes back to rheumatic fever. Is there a gene associated with this that we are aware of, and does it pass from mother to child?
Yeah, there's a lot of medicine right now that is looking at things like genetic structure and specific genes or markers, as we call them, that are handed down, that can pass on, that can give you indications whether you have a predilection for something or the other. Mm-hmm. And so you have that type of situation.
Now the next.
Unfortunately, in Guyana, well, we don't have the technology to identify these markers.
Yeah. The next scenario, I'm sure almost every parent has gone through this. Your child is having a fever, and you've diligently measured out the medicine based upon the child's weight, and you've given the child the medicine, and he or she promptly spits it out or vomits it out. And it's 2 o'clock in the morning, mm-hmm. and the mother is about to cry with the child. Mm-hmm. What does she do? Or is already crying. What does she do at that time?
Or it depends on how much vomiting the child has done. One, usually most of these medications have a color. If the child has vomited and you look in the vomitus and you've seen whether the color of the medicine, paracetamol is reddish, etc. Yes. Ibuprofen is orange in color most of the time, unless it's Advil, it's grape flavored. If you see some of that inside, then that would be an indication that he hasn't kept down enough of the medication. That would be an indication to give him another dose. If you're not sure, okay, then you can wait, because usually ibuprofen will take 20 to 30 minutes to act. Usually paracetamol takes about 45 minutes to an hour to act. You can wait for an hour, and if nothing has happened and the child's temperature is still the same, you can do one of two things. You can either give the second medication, which if you've given paracetamol, give ibuprofen, and vice versa, or you can repeat the dose of the medication an hour after. Okay. And that double dose with such a close space of time will not be harmful to the child.
Okay. Now, what about the role of suppositories in children? I mean, is there an age group, or we generally don't want parents to use it? What would you be saying to your parents?
Depends on which country you live in. If you live in France, that is the ideal way to give medication. In France, they use mainly suppositories for giving medication to children. The only difference with it is the route at which you're giving the medication. It's absorbed just as well from the rectum as it is if you give them to drink and it goes into the stomach. And so, especially for a child who's going to be vomiting and vomiting up, or a child who's spitting it out and doesn't want to, then the suppository route is by far an excellent route to give the medication. And it will be just as effective.
And you follow the instructions that come with it as per well. The next question, which is from Sam in Diamond, it deals with an issue that has come up recently with a vector, this mosquito-borne virus, chikungunya. I hope I'm pronouncing it right.
Yeah, it's chikungunya.
But his question is, my child has chikungunya and the fever is not breaking. I think we need to break that up in two. We'll have a few moments later where we will discuss chikungunya.
Okay.
But let's break that into two questions. So you've got this fever in a child, and the fever is not breaking. Let's deal with that part first. What is the expected time period after you've given the medicines, and what is fever not breaking imply?
What people don't realize, chikungunya is a virus. It behaves like the influenza virus. It's a flu virus, except it's got some characteristic symptoms, just like chickenpox is a virus. And so chickenpox, you recognize it comes out in a specific type of spots, and it runs a particular course, etc. Chikungunya is exactly the same. And so the thing about chikungunya, it's quite a serious virus, just like dengue, etc., where it really puts the human body under a great deal of stress. And it will affect a multitude of the organs in your body, especially things like your joints, etc., and your skin. And so you'll get skin rashes, you'll get skin joint involvement, you'll get muscle aches and pains, you'll get bad headache, you'll get eye pain. And above all, you're as weak as a kitten. You cannot move. It hurts to walk. My daughter just is now getting over it. It was really rough on her, 17-year-old. And so what you're going to find is that in a person with chikungunya, the body, because it's such a strong virus and it has such a strong effect on the body, that the body is going to need all the help it can get to fight it. And so one of the things it'll do is give you a high temperature and raise the temperature and keep it there for a while. Okay? And so you want to try to bring the temperature down, but not a lot. The more important thing of the antipyretic there is that it has a secondary effect, and that is pain relief. And the main purpose of this type of medication is so that you feel a little bit better, that you don't feel as lousy, and you can move around a little bit, and you're willing to take a bit of fluid. Because when you feel as bad as you do with something like chikungunya and dengue, you don't want to move, you don't want to do anything. Mm-hmm. And so you need the supportive fluids, and so taking things like the antipyretics will help that as well, so that they'll tend to take the fluids. But in terms of trying to bring the temperature down a lot, you really shouldn't. You should give the body a chance. Yeah. If the child, as I said, is irritable and is showing signs that he might have a febrile convulsion, then that would be a criterion. Okay, let's give him a little bit extra medication. And so sometimes we'll use combinations. We use a combination of both the paracetamol and the ibuprofen or the NSAID type medications, of which there are a few of them. Aspirin, we don't tend to use aspirin with chikungunya because it's hard to distinguish from dengue, and dengue will lower your platelet count and make you bleed. And so you don't want to use aspirin in a situation like that. Yeah.
Now, I'm certain that many of our viewers have a lot more questions on chikungunya. And both you and I spoke to the Chief Medical Officer, Dr. Shamdev Prasad, earlier. Yeah. And we will come back a little bit later in the program to spend a few minutes on that. The next question from Wanda in Kitty talks about fever in a child with asthma. And Dr. Jabour will be coming back in a later program to specifically discuss with us asthma in children. But let's deal with this particular question, which is a parent has a child, known asthma, and the child now has a fever.
Deal with that type of scenario. Asthma by itself has particular symptoms and criteria, and most of those don't need a fever. Because of the nature of the disease, you tend to accumulate mucus and secretions within the lungs. If it's been there long-standing enough and the child has not been treated and is having a lot of difficulty with breathing because of the blocked up lungs, the mucus that's there has been sitting there for a while and it can be stagnant. And if it's stagnant, it's a good breeding ground for bacteria. And so the clue will be that he's having his asthmatic attack for a few days, he's not getting better, you're giving him his asthma medications, and they don't seem to be working very well. And then he starts to develop a fever. That would be the point in time at which you'd want to introduce an antibiotic. Okay? Usually, though, in asthmatics, if they're having a straightforward, simple asthmatic attack secondary to a virus with little or no fever, you usually don't have to use an antibiotic.
Okay. Now, in terms of lowering the temperature, do we want the parent to use more than one medication, stick to one medication? What is your recommendation to the parents?
Ask the child.
Okay.
He'll tell you by his body language. He'll show you whether he needs it or not. Okay. If you've given him and he's not responding and it's 2 o'clock in the morning and his fever is sky high, I'd give him the second antibiotic.
Okay.
In addition.
Now,